Becky Berkeley's 16-year-old son Brandon died of an asthma attack in 2019. That's when she recalled a conversation with him about becoming an organ donor when he'd get his license.
We never knew how fast we were going to have to honor that decision because it was just a couple weeks later when everything had happened.
Through that tragedy, his choice to be a donor proved life-saving for more than 70 people who received organs and bone marrow.
We just got a letter a couple weeks back that one of his tendons just helped a lady this last month. After 2 years, he's still helping people.
The impact of Brandon's decision led Becky to become an advocate for LifeSource, an organ procurement organization that works with hospitals to connect people on a wait list with donors.
He made the comment, he said, why doesn't everybody do this? And I said, I don't know. I said, but maybe that's something we need to work on. And here I am trying to do that. I'm trying to work on it.
Despite hurdles brought by the virus, which made many potential donors ineligible, in 2020, LifeSource saw its second highest number of donations in 30 years, and that trend is continuing.
We're on track this year for 2020 to be our highest year ever. So the generosity, the amount of people saying yes is truly inspiring despite everything else going on.
Communications manager Sarah Sonn says 145 North Dakotans are currently waiting for a kidney, and the percent of potential donors is small, not only because just 54% of North Dakotans are registered as donors, but because of the criteria.
That's one of the unique things about organ donation is it's so rare because you need to be on a ventilator, you need to pass away in a hospital, be free of active cancers.
Sanford Health Bismarck's transplant nephrologist Dr. Diego Beltran says Sanford saw a significant drop in transplants during the early months of the pandemic when little was known about the risks involved with COVID. But with vaccines now available, the number of transplants has returned to normal.
Seen a normalization on the number of organ offers, at least for our center. We haven't been seeing a significant increase on the number of donors, at least not here in our center.
He says there are about 80 patients at Sanford Bismarck currently waiting on a kidney, a process that can take 5 to 6 years. But once a patient gets one, it's life-changing.
It's the biggest gift that you could possibly, give. Any donor available would change the life of any of our kidney patients.
Reporting in Bismarck for KX News, Maddie Beer Temple.